Hello, thanks for visiting. This is my first official video going out to family, friends, and web visitors. First video after being diagnosed with cancer. I have what's called acute myeloid leukemia, which is a blood disease and it gets into the bone marrow. Mine is acute because there is I have a 38% blast, they call it, which means that 38% of my bone marrow has at this point been affected. I've just undergone chemo, and from what the doctor says, it was successful. It was very harsh. I won't go into all the details of that, but it was very harsh, and from what I've been told, the worst days are still to come. Probably within about the next 2 weeks, I'll be at my lowest, really. And then about a week, the third week in, I will have a bone marrow scan to see if I'm in remission at that point, and that's the goal. Then I'm probably looking at about a year of continued therapy and treatment to remain in remission and hopefully stay in remission permanently thereafter. If at any point in time during this process, if the chemotherapy is not successful, then we will opt for either a stem cell transplant or a bone marrow transplant. Those would be my options at that point. I appreciate all the support from family and friends, the prayers, the thoughts, the financial donations. It's all appreciated very much, and it means the world to me. And I guess the point of this video is that the hardest part here for me is the shock. Realizing that you have cancer is a startling, stark reality. As I took a walk the first few days I was in here, I felt okay and was taking a walk through the halls, and I was kept coming down the one hall towards my room, and it was the leukemia specialty care unit. And I was, the first thought that hit me is, well, I don't know about anyone with leukemia. Why am I here? And that thought is still kind of lingering with me. It's not that I'm in denial of the facts. It's just that this is not the life that I know and that I'm supposed to have. At least not until now I guess I am accepting of that. But if you're wondering, my hair has not fallen out yet. This is kind of a precautionary measure that I've done here to shave this off so that I won't be in shock in the next couple of weeks when the chemo really does its thing, and that's when I'll be at my lowest here in the next couple of weeks. But I do plan to stay in touch with ongoing videos of my progress. Thank you again for any financial donations. Thank you for the prayers and the thoughts. Stay in touch with me if I'm not regularly in touch on Facebook or wherever. Just feel free to check in on me. So far I'm doing well. I know I haven't posted in the last few days, but I've just been dealing with the effects of the chemo and trying to hang in there. So I will be in touch, and thank you for visiting. Bye-bye.